Hi everyone, I hope you're all doing really well. Today's video is the fourth video of the diabetes videos I've been doing. If you are seeing my face for the first time, then hello, my name is Soraya and I have type 1 diabetes, and I do a series of videos every couple of weeks on different topics about type 1 diabetes. So if you aren't subscribed already, then please go and hit that subscribe button just before you watch this video. I have left a link down below to the first 3 videos that I have done, so if you want to go and watch them before you watch this one. They are quite long because there is a lot of information obviously to pack into one video, but I also do some blog posts on each of the different topics which I talk about. So if you do want to have a read instead of listening to me on a video or watching me, then my blog is always linked down below in the description box. After the longest introduction in the world, this week I am talking about hypoglycemia. Hypoglycemia is basically the word we use to describe when a blood sugar is too low. So this is basically when it drops below 3.5 millimoles per litre. 3.5 is low whether you have the symptoms of hypoglycemia, which I will talk about in a minute, or not. We refer to hypoglycemia as hypo for short, so I'm going to use the shorter version of that word for this video. Hypoglycemia is actually caused by the effects of insulin, and it needs to be recognised and treated as quickly as possible. So there are 2 types of hypos. There is a mild hypo, which is self-treated by taking a fast-acting carbohydrate, which I will come on to in a minute. And then there is a severe hypo, which is where you can't treat yourself and you need the help of somebody else to get your blood sugars back up to the normal range. This could be someone giving you a carbohydrate by mouth, or in the more serious cases, you may become unconscious and have to go to hospital or need what's called a glucagon injection. Causes of a hypo are overestimation of insulin. So if you give too much insulin, basically more than you needed, then you are going to cause your blood sugars to drop. If you're doing more exercise than you plan to, so this can be anything from like being in the gym, housework, anything like that, if you get intimate with a partner, things like that, anything that involves physical activity, if you're doing too much of it, this can cause your blood sugars to drop too. There are some alcohol beverages that if you drink them, firstly they will make your blood sugars go really high, and then later on they will just slowly start to drop. Alcohol actually makes it really difficult for glucose to be released from the liver when it's needed. So alcohol is kind of something that if you can avoid it, stay away from it. Symptoms of hypos can be different for everybody. Not everyone who has type 1 diabetes will have the same symptoms. There are actually some people that lose their warning signs of hypoglycemia. This is known as hypo unawareness. Some of the early symptoms of when you start to go hypo, so when you start to get to that 3.5 millimoles per litre borderline, you can start to feel really hungry, you can start to feel shaky, a bit sweaty, and you can get a bit of a headache as well. If you don't recognise these symptoms straight away and you don't test your blood sugars to make sure that you are at that low point, we refer to it as being low. So being hypo, we say we're low. Then obviously if it doesn't get treated, then your symptoms become a bit more severe. So you may feel disorientated, you may feel a bit aggressive, you may begin to lose consciousness, you may begin to feel a little bit sick. You might have difficulty with your speech. So a lot of people compare the symptoms of being severely low to kind of being drunk, because you can't get your words out properly, you kind of slur your words. You also can lose concentration, and you can also experience blurry vision. Now, these more severe symptoms tend to occur mostly when your blood sugars are dropping to about 2.8 millimoles per litre. If a hypoglycemia drops below 2.8 and isn't treated, then this can lead to unconsciousness. But it is best that when you start to feel symptoms or anything like being in a hypo, it's best to always test your blood sugars just to make sure, because sometimes you could be feeling the symptoms of being low and you might not actually be low. So it's always best to just check, just to keep your mind at ease. The symptoms that I get when I have a hypo is I start to sweat a lot, I start to shake a lot, my hands just start shaking, I feel really weak, I have difficulty in speaking, so my speech goes really slurred, I have slow responses, my face goes really pale, feel hungry, I feel a bit confused and a bit lethargic. And then if I start feeling like that, straight away I will test my blood sugars to make sure that it is a hypo that I'm having, and then treat it accordingly. I was talking about some people have hypo unawareness, and this is basically when, if someone has had high blood sugars for a long period of time and hasn't treated the diabetes very well, then they can become unaware of their hypo symptoms, or they can start feeling as if they are having hypo symptoms when they're actually not. So some people are so used to having high blood sugars all the time, so a high blood sugar can be like over 8 millimoles per litre. Some people who are constantly on a high blood sugar level can be at a normal range blood sugar level, so they could be at a perfect reading of 6 point something, and they could have hypo symptoms, and this is because the body isn't used to having those normal readings, so the body starts to feel the hypo symptoms without actually being hypo. This is why, again, I say that it's always best to test your blood sugars, because I've had it myself where I've been in a situation where I've felt like I'm really low, and then I've tested my sugars and they're actually quite high. Sometimes that happens, so it's always best to check. Anyone with type 1 diabetes can potentially lose their warning signs of hypos, so their symptoms of hypos. It more commonly occurs with people that have had diabetes for a long time, or if you tend to have blood sugars that are lower than 4.5, so they should always be between 4.5 and 7, no lower than 4.5 over a long period of time, because people who do not have diabetes don't run at blood sugars lower than 4.5. So as someone with type 1 diabetes, you need to make sure that you're trying to hit the target of 4.5 and above. The brain adapts to the blood sugar that you're running on. So if you're running constantly high, then as I mentioned earlier, your blood sugar, your brain won't know that you're not having a low when you're at a normal blood sugar. And it's exactly the same thing. If your brain is used to running on a lower blood sugar, then when you are hypo, or when you are below 3.5, your brain might not realize that. So if it drops to lower than 2.8, that's when it can be really dangerous, and people should avoid driving or operating machinery if you think that you have lost your warning signs of hypos. You just need to make sure that you're checking your blood sugars frequently, that you're running at the normal targets. But if you think that you're possibly giving yourself too much insulin, or that you're becoming sensitive to insulin, then these are things that you can talk to your doctor about and discuss with them. The treatment of hypoglycemia is basically, if your blood glucose is below 3.5, you need to treat it with a fast-acting carbohydrate. So this is anything from energy drinks, so preferably something like Lucozade, fruit juices, especially orange juice, that's a really good one, jelly babies, Coke, or you can get some like glucose tablets as well. And after you have taken one of those things, 10 to 15 minutes after taking it, just test them again to make sure that it has worked. With all hypo treatments, if within 5 minutes you don't see an improvement with the fast acting carbohydrate that you've had, then just repeat it again. Just take the same dosage of what you just had again, and if that's not working, just keep repeating the process until it does. But obviously you need to make sure that you don't take too much of the sugary substances, because then your blood sugars can go to the other end of the scale and go too high. So this is why you have to take your fast acting carbohydrate, wait a couple of minutes, test. If it's not going up after about 5 minutes, then you know to keep repeating until it does start to go up. Once you are feeling a bit better and your blood sugars are back to normal, you might want to consider just eating something like a cereal bar, a biscuit, drinking some milk, or eating a packet of crisps or something like that, just to keep you from dropping again. Because what tends to happen when you have a hypo is within the next 24 hours you are more than likely to have another one. So if you have like a little snack once you're feeling a bit better, then it's just going to prevent you from going low later on during the day, especially if you're out walking about, or if you're driving or something like that. You want to prevent having another hypo, and this will keep your blood glucose up until you have your next meal. Severe hypoglycemia occurs when the blood glucose drops too low, and this can cause your brain not to function properly. Below 2.8 millimoles per litre, this is when it becomes quite dangerous, because this is when you might need the help of somebody else to help you treat your blood glucose. Someone else should only ever give you something by mouth if you are conscious. If you are unconscious, then the person trying to help you should just ring an ambulance straight away. It is always best to ring an ambulance if someone with type 1 diabetes has fallen unconscious, rather than trying to treat it yourself and not knowing what you're doing, and leaving the person unconscious could result to the person passing away, because the longer they are left unconscious, the lower their blood sugar drops, and if it gets to 0, then obviously that is life-threatening. So I always say to my friends and family, if I can treat a hypo myself, I will. If I ever, fall unconscious or, faint or anything like that, just call an ambulance. Don't try and do anything else. Explaining anything to do with diabetes is so difficult, let alone explaining what people should do in an emergency situation. So it's always best to just call an ambulance, and they will definitely know what to do. On my blog post, I've actually put a few charts and different tables and stuff like that, which will make this a lot more clearer, because this is very difficult to explain, and hence why these videos are so long, because it's a lot of information to take in as the viewer. It's a lot of information for me to try to explain. But yes, on my blog post there are tables which sort of make everything a lot more clearer. So I don't know if I've even explained any of that really well. I don't know if you guys will understand anything that I have just said in these last minutes, but if not, then I always tend to explain things a bit better on my blog. I just like to do a video and a blog post, because people have different preferences. Some people like to read, some people like to watch and listen to a video. So that's why I always tend to do both. I really hope that I have helped at least one of you in this series of diabetes videos that I have been doing. And if you did enjoy this video, give it a big thumbs up. Please share it with friends and family if you know anyone who has type 1 diabetes, or even anyone who doesn't have type 1 diabetes and just wants to be a bit more educated. I know I'm not a professional in any way. I am going to stop this video now before it gets super long. Next time I will be talking about the diary that I keep with all my blood sugar readings, and also I'll be talking about quite a huge topic of carbohydrate counting, which took me absolutely ages to figure out and to get used to. So I don't know if that's going to have to be split into 2 videos or not, but we'll see how it goes. I hope you did enjoy this video though. I'm so sorry that I've been talking for probably hours, and I will see you very soon for another video. Goodbye.